Time now for French Connections, our weekly look at the intricacies of French life with Florence Villeminot. Flo, many viewers have been curious about France's healthcare system, a system that is ranked among the highest in the world.
That's right. French people are very proud of their healthcare system, which was actually crowned best healthcare system in the world by the World Health Organization back in the year 2000. Now, this publicly funded system is very similar to other systems, it must be said, whether it's in Belgium or the UK or Germany, but it is particularly an object of fascination in several countries, particularly in the US, especially during the whole Obamacare Act. The French system came up time and time again as an example, or maybe a counterexample. And there are often articles about our healthcare system. Check out the latest article in the New England Journal of Medicine. This is a very prestigious journal, and you can see this article applauding the quality and generosity of the French system.
And it's not just generous, it's also very wide-ranging.
That's right. The system is universal, meaning it covers all legal residents. All French residents over the age of 16 have one of these. This is called a carte vitale. It's a health ID card that's really come to symbolize French healthcare, or assurance maladie. You can see an extreme close-up of my card here with a different photo, it must be said, because I look like a zombie in my real photo. Now, it can get a little complicated.
You doctored your card.
I doctored it up, a little Photoshop. It can be a little complicated to actually get this card, but once you get it, it's really easy to use. You just go to any point of care and you swipe it, and it contains all the details for your rights to medical treatment and refunds, which it must be said are very generous in France. The government refunds 70% of most healthcare costs and 100% of fees for serious or chronic illnesses like cancer or AIDS. Because it must be said, solidarity is a crucial part of the French healthcare insurance system. The more sick someone becomes, the less they have to pay.
And the truth of the matter, and this may surprise some people, is actually that the French healthcare system isn't as expensive as in other countries.
That's right, and that's because the government participates in setting what they consider fair prices for appointments, procedures, and drugs. And since it covers the entire population, it has a lot of bargaining power. And you can see here, since January of this year, the cost of visiting a general practitioner is at least 23 euros, which is pretty cheap compared to other countries.
And still, actually, it has to be said that most French people also sign up with to an additional complimentary private health insurance, and that tops up their reimbursement to a full 100% usually.
That's right. 85% of French people have something called a mutuelle, private medical insurance. It's a very important thing here in France, and so it's our word du jour. It costs on average about 54 euros a month. It covers things like, going to the dentist or getting glasses, things that aren't covered 100% by the state. And if you spend any time in France, you've probably heard about the mutuelle because there are advertisements for mutuelle all the time. Competition is really fierce, and so they try to be creative with their jingles. I've pulled out a couple of examples for you to listen to. These are things you can see at the movies, for instance.
La santé, c'est la matmute!
Efficace et pas cher. C'est la maths que je préfère. C'est la maths. Zéro tracas, zéro blabla. MMA.
They're pretty catchy.
Everybody knows that one.
Everyone knows that one. Now, the reputation of France being a 100% socialized system is wrong. It's actually a hybrid between a public and a private system, and this is very advantageous for patients. Let's listen to a pharmacist tell us about it.
Here we have a prescription for about 55 euros. National health insurance covers 34, private insurance covers 21. The patient doesn't pay a thing. Customers say the pharmacy is the only place they can leave with a full bag without spending a single euro.
So if people actually don't pay very much for their health care and this level of service, who actually pays for it?
Well, the national health insurance is financed by taxation and participation from workers and employers. If you look at your pay slip, for instance, you'll see a small percentage goes to this very generous system. So you pay a lot into the system, you get a lot out of the system. It must be said, though, that in recent years, the system has been struggling to stay afloat. Why is that? Well, rising unemployment and an aging population means that less money is being pumped in to the system. But the problem is spending has increased. France spends a lot of money on healthcare, just over 11% of GDP. French doctors, for instance, are known for writing out, prescribing a long list of medication, which actually means that France is one of the world's highest consumers in prescription drugs, particularly antidepressants.
And every government here in France, right and left, has to contend with this issue. This government has put in place a series of measures to cut spending, but it's still facing a towering deficit.
That's right. Let's look at the figures from last year, 2015. The healthcare deficit came up to 7.4 billion euros. That's the lion's share of something called the trou de la sécu. This is the massive deficit of France's wide-ranging social protection program called la sécurité sociale, which roughly translates as social security. It covers healthcare, but a lot of other things as well, pensions, generous family subsidies. I'll tell you more about sécurité sociale in another French Connections because it's a really big deal.
It's a subject unto itself.
It's really its own topic, but it's something that French people are very attached to. Let's take a listen.
It's an extraordinary system, even if we take advantage of it a little bit.
Some do, but we're so lucky it exists. We're lucky to live in a country with social security.
And what we just heard touches on a very important point. Though it costs the state a lot of money and it's losing money, French people are very attached to the healthcare system.
That's right, and particularly the philosophy behind it, that solidarity. Whether you're rich or poor, you won't drown in medical bills. You're not going to fall through the net. Everyone has their own, happy healthcare system story. Me, for instance, I was born 6 weeks premature. I spent several weeks in the hospital, and my parents joke about the fact that when they had to go and pay the bill at the end, they were worried about how much they were going to pay. It only came up to about 7 francs at the time because my father had a glass of wine in the hospital room. So you can see that's quite a common story, a happy healthcare story, which is quite unusual compared to other countries.
Yeah, and you recognize just how generous it is when there's a serious illness in the family and costs are taken care of. That was French Connections. If you have any other questions you'd like us to answer, be sure to tweet Flo at FloVillemino, and be sure to check out our previous shows on our website as well, www.france24.com.